Hi, I'm Dr. Allan Perel. This is Conversations in Medicine. This program brings cutting-edge medical topics to the Staten Island and tri-state community. We have something very different we're going to talk about tonight. We're going to talk about aesthetics. And it's a major part of medicine right now. People want to feel better. There's no reason people shouldn't feel better. There has been a field of plastic surgery for years. People have gone to estheticians for facials and all kinds of other procedures to look better. And the idea, if you look better, you feel better. So I'm going to introduce my wonderful, wonderful guest. First, I'm going to go all the way down here and say this is Dan Ostrowski, Dr. Ostrowski, Doctor of Nursing. Mm-hmm. And I wanted to introduce Roshani Gunawardena. Hope I didn't do too badly with that.
You got it.
She's a nurse practitioner and someone who's working at the Staten Island Aesthetic Center. And I'm just for everyone there, I am working there also. My nurse practitioners became very interested in aesthetics. And as a neurologist, we were looking for the well-being of everyone. And we do a lot of work with botulinum, Botox. We have hundreds and hundreds of patients we give Botox for migraine headaches. We also use Botox for people with MS and spasticity and strokes. And our patients have asked over the years, could you just do some work with us with regard to Botox for cosmetics? And after the urging of a number of my nurse practitioners, 2 of them who are here today, we decided to go into it and try to help people on a lot of different levels. But I'm going to talk to the real people who do most of the work at the center, at Staten Island Aesthetics. So, Roshani, tell us a little bit. You're a nurse practitioner. For those who don't know, what's a nurse practitioner?
So it's a bunch of schooling that you have to do. So I started as an RN.
Registered nurse.
Registered nurse. I got my BSN, which was probably the hardest thing I ever did. It was 15 months. And then I met one of my professors, Dr. Aurelius, and she specialized in psychiatric mental health. And my background's in psychology, so when I met her, I was like, okay, this is where I want to go further in. But to even go back in my story, I became a registered nurse to go into aesthetics. So my passion has always been aesthetics as well as mental health.
But why aesthetics?
I mean, like you were saying, when you feel good about yourself, that radiates from the inside as well as outside. And I mean, aesthetics goes from a simple facial to injectables.
Okay. And Dan, tell us about a doctor of nursing. You know, you're a nurse practitioner for a number of years, and as I said, our center is always so proud of you and really an honor to work with you. Thank you. So tell us a little bit about your background.
So I started off as an RN and graduated in 2013, went on for my bachelor's in nursing, and then pursued my master's in nursing, which made me a nurse practitioner, and then I went back to school to get certified in psychiatric mental health nurse practitioner, and then I went back to school again to complete my doctorate. But I started off in an ICU, in a medical, surgical, and neuro ICU, which really fostered my love for patients and patient care, and then that kind of pushed me to have more autonomy and try to kind of treat the patient, more as a whole and be more involved. Mm-hmm. And then when it comes to aesthetics, to a couple on what Roshani said, making people feel good both internally and externally is worth, his weight in gold.
So what's interesting, none of you mentioned the word beauty. Mm-hmm. It's not to be beautiful. It's not to look like someone on television. It's just for you yourself to be what you want to look like. I think one of the things that I noticed most when I have taken a number of courses in aesthetics is they always ask, bring a picture of when do you think you look good? And some of the sad parts is if it's someone who's, say, 60 years old and brings a picture out of high school or college, 40 years before, there's no way that you could ever transform people to that. But if they bring in a picture of, say, 5 years ago when you looked a little bit different, there's clearly a lot of ways that people could feel better about themselves and maybe just bring back some of those type of things. So let me ask you a real general question. Women go for aesthetics more than men, is what I've been told. And again, we've seen this at the practice also. Do you think aesthetics is for everyone on a certain level?
It really goes to their comfortability and if they're comfortable with themselves, when they look in the mirror, if they like what they see back. There's always could be like little adjustments for everybody, but again, it all goes on how they feel. Women are more popular, but men are definitely picking up with it. In particular, they want to look good, want to feel good, and everybody wants to turn back time and go back to a younger version of themselves as best as possible.
So, Roshani, you've been doing this for the longest amongst the three of us.
Yes.
So we're going to ask you all the hard questions.
Oh,
then.
gosh.
So tell us a little bit. First of all, as I asked Dan, do you think everybody could use aesthetics? And again, when I say aesthetics, it's interesting because I think about going for a facial, which I've done before, and is that aesthetics? It is. Mm-hmm. Is there any way to take off little brown spots or things that might have a little bit of an effect on the way your psyche or feel about yourself? So do you think everyone could benefit from some aesthetics?
I mean, there is like a negative connotation with like vanity, but I do think like for your psychological well-being, there's definitely something empowering when you do an aesthetics treatment. Mm-hmm. If you need like a pick-me-up, if something bad happens to you, a simple facial can make you pick up your day. Or maybe you started to see some fine lines. Maybe you've been stressed out for a couple months or years and you want to address those static lines that are developing. Some injectable may address that feeling. It just like once you look in the mirror, you start to feel good about yourself. I mean, of course, you want to look beautiful, but it's always improving and enhancing the beauty you already have in aesthetics.
So for the people who decide, okay, they take that first step, we're going to do something, whether it's having a facial, and this is where I really want you guys to give me some definitions. And we're going to go all the way up towards plastic surgery. And clearly at the center we're working at, there's really no plastic surgeon there. So that's a whole different level. So let's go over just some words for people. What's a facial and are there different kinds of facials?
Yeah, there's definitely different types of facials. I'm more versed in hydrofacial, and there's like 4 steps in that where we deal with exfoliation, extractions, getting those blackheads, those whiteheads that you see. A peel, putting some antioxidants back into the skin. And at the clinic, we do other facials that you do.
Exactly. And we also a couple on dermaplaning as well. It's all really about getting rid of the dead skin on the top and bringing that glow back to the skin. And also, as she said, getting rid of impurities such as blackheads and whiteheads as well. And infusing, treatments in that are hydrating, anti-inflammatory, things like that. Mm-hmm.
A majority of aesthetics, or these things that we were talking about, are really applied to the face. I know we're going to talk about other parts of the body. Let's talk a little bit about medical aspects of this. So we're talking about the face, we talked about facials, and then you told me that the center also takes care of something, and I really wasn't that aware of it, like people who have acne. Mm-hmm. And I know you brought one of your pictures here, and again, seeing a before and after, we could show it to the audience briefly, but the idea of how would someone get rid of their acne? A facial obviously wouldn't do that. What kind of things or what has to be done? Because we have so many of our viewers and so many of my friends and so many people that I went to school with everywhere around have these acne scars. The things that we didn't have. We weren't as smart as we are now with different treatments, especially for teenagers, in order to know understanding their mental health. Acne has become a big deal. But there still are people who do get acne, and I see this in my practice. I see this all over the island just by going around. And you start seeing people who have scars on their face from it, and many people, especially as a neurologist, and again, I know both of you have done a lot of work on the psychiatric side, it really will talk about that, how that bothers them. And once I started learning a little bit about some of the works in aesthetics, and again, we'll talk about various microneedling and radio frequency ablation and things like that. But really, the question comes down to is there a treatment for something like acne? So a lot of people might be watching here tonight and saying, well, I'm not going to go to the expense of having a facial. I don't need the glow. But if your son or daughter happens to have acne and is concerned about it, what can someone do?
Good question. First step, facial is not a bad idea because it really gets on the top layer, cleans the skin, but there are other treatments that go deeper, that really get at the bacteria, help to shrink the pores, the sebaceous glands in particular, that are known to cause acne, such as Morpheus.
And Morpheus is a brand name
Morpheus is a brand, correct. It's radio frequency, so it combines microneedling with heat. So the microneedling, penetrates the skin and puts these micropunctures, and then your body heals, which helps to build collagen. And then the heat part of it actually can kill the bacteria under the skin, and again also helps shrink these sebaceous glands that are known to cause acne. So coupled together, as it is one treatment, can help with acne and can also help with acne scars as well. And then there is Lumecca, and Lumecca handles issues with pigmentation of skin. If there's any kind of redness or blotchiness, it can also treat acne scars and help shrink them and give a more natural look. Both treatments can help build collagen and help stimulate your body to kind of heal itself ultimately.
So let's not move on, but so we talked about acne a little bit. We talked about, and again, I want to bring that medical aspect. That was like the medical portion of the show. This is Conversations in Medicine, and aesthetics is part of medicine. So Roshani, tell me a little bit. So you talked about facials and the hydrofacial. We talked about also laser facials. What kind of lasering is there? Is it dangerous? Is it something like a nuclear type thing where you're
not necessarily like surgery? Like Dan was addressing the acne scarring. There's something called Clear and Brilliant as well. There's the original and the Permea. The original will target like the fine lines, collagen remodeling as well. And then it also can address the pigmentation, the hyperpigmentation you may get from acne scarring or from the sunspots. That's another laser, and there's minimal downtime. You may have like swelling, redness, but then you could go back to normal scheduling in a couple hours and you're fine.
So like those are lasers for like the little brown spots on your face, arms,
the
whatever.
sunspots.
And that's those
that just sneak up on you.
And another word for sunspots are age spots.
Exactly.
Right? So if you have less of them, we feel a little bit less than it. So let me ask you. And I'm going to even say, I'm as the interviewer and sort of being part of this, is who should do this? Is it somebody like going to a store? I mean, I'm sure people all over the island, all over the city. I see all these places. What's the level of comfort, and who should be doing these kind of procedures? And maybe I'll ask Roshani.
Anyone can do it. I mean, it's just really what you want to address in aesthetics.
But I'm saying on the healthcare professional side. So anyone, I think there's a certification for an esthetician.
Oh, yes.
Right, so I'm saying you don't want anyone
to
do
go to
it.
Okay.
Right, that's what I'm saying.
You want to go to a licensed medical professional, an NP, a doctor, a registered nurse, a PA, but that has specialized training in aesthetics.
So basically you go from one step. Facials, of course, estheticians do them. They do a wonderful job. We even have an esthetician in our center who really works, who's wonderful. I mean, Nicole is one of the best that I've ever seen. Not that I've gone to so many places, but my family has told me that, and you guys have told me that. And she works in Manhattan and out there, so out on Staten Island, at our offices in New Dorp, but really does a great job, and she knows what she's doing. But then there's certain things that you need a nurse practitioner, physician. So we'll say, well, all the way here, like doing plastic surgery, obviously you'll need a surgeon to do it. So there are different levels of it. So maybe give me a little bit of idea what it takes, what a nurse can do that say an esthetician can, or a nurse practitioner.
Well, for New York, like for hair removal, you have to be a registered nurse. To do injectables, you can be a registered nurse in New York, but however you go to Jersey, you have to be a nurse practitioner.
So let's go what injectables are. So you mentioned hair removal. So hair removal, you really need to have either a certain degree with it from the esthetician, or be a nurse or a nurse practitioner, or a physician. But maybe we'll jump first into hair removal. So tell me, this is the time of year that a lot of people want hair removal.
Probably the most common thing people come in for. Unfortunately, like people think it's permanent. It's not 100% permanent, but it's going to definitely reduce the reduction of hair growth.
And how does it work?
So you use a laser, and it's going to attract to the pigment and kill that follicle. And then, as you know, hair grows in different cycles, so you want to come in every 6 to 8 weeks, depending on the area that we're treating, to target those hair growth cycles.
So again, a very common thing that people use for it. Now, so we talked about those kind of things. Now let's go into people who are looking for more aggressive type things. And people sometimes will say, I really want a facelift. There's a reason. It doesn't take much to say that. I want this picked up. I want things sag. So maybe tell us, what does aging do to the face? So
as we age, we start to get muscle loss, and then that's when you start to see like the jowling, starting to see like the sinking of the cheeks. Start seeing your platysmal bands a little bit more when you make faces. So as we age, you'll start to see little differences from how you looked 10 years ago. And this is where aesthetics comes in handy. But you want to try injectables, fillers.
So let's break down injectables.
Sure.
So when you say injectable, of course, there are things we give injections.
Right.
So as I mentioned before, we are Botox gurus.
Right.
We use a lot of Botox for all kinds of things. I use it on the medical side more for migraine headaches, for people who have stiffness, spasticity, cerebral palsy, strokes. We have hundreds and hundreds of patients on it. Tell me on the cosmetic side. And what Botox does is what? Or botulinum toxin is a better word, because there are a lot of forms of it. It actually makes a muscle weaker.
Right.
Why it works for headaches is interesting because it actually blocks some of the sensory fibers too. So there's a lot of reasons it works and helps pain in a lot of ways. But with regard to giving Botox for people who have wrinkles, say, or have the 11. It doesn't
The
take much.
famous
No, and actually I could show it to everyone. It's right here, as everyone knows. You guys are too young and beautiful. But yes, it's there, or the crow's feet. How does it work?
So what I usually tell the patients to do is make a couple of silly faces for me where you're normal, make an angry face, raise your eyebrows, smile. So we see where exactly the movement is and where we're going to address where those static lines are or where those static lines are forming. And this is where you need your nurse practitioner, your RN, so you're getting the correct injection spot, because you don't want to deal with something like ptosis or any other issue.
Right, there's droopy eyelids
Right.
and everything else. So you have to know where to do it.
Correct.
And what it does is it actually weakens the muscle. So it makes the muscle a little bit weaker, so you can't really crunch your face
Right.
as much.
Not
As we see with
expected.
all the actors and people on other television stations. Here we could have natural wrinkles and when we wrinkle my forehead, versus people who have one eyebrow up and one eyebrow down. And what I learned from that is interestingly enough that not everybody gets it right. Sometimes and sometimes it's your anatomy, sometimes it happens. And one of the good things about botulinum toxin or Botox is that it wears off over about a 3-month period. So, and there are little tricks you could do to try to make it even if it's not perfect. So there are ways we could work around it. I'm sure that you're expert with this. And again, it's a lot of fun for us to do.
Yeah.
So Botox is mostly for wrinkles, is correct?
Fine lines, wrinkles.
Fine.
Yep, correct.
What's this concept of filler? I mean, what does filler mean?
So filler is like, people get this mixed up with Botox and injectables. Filler is addressing the volume loss. So you would use filler to create more volume in your face and the contouring. Now, sometimes people are a little afraid of filler, and this is where you could be using PRF.
So that's what PRF stands for.
So PRF was my favorite. So it's platelet-rich fibrin.
Right.
So what this is, the difference between PRP and PRF is that PRF is spun a little slower. So that means that the growth factors are being released at a slower rate, but however, they're staying active for a longer period of time compared to PRP. So it's stimulating collagen, healing, and for if people are scared to get filler in their face, this is coming from your own body, and this can be used in your cheeks, your temples, the under eye, the hollowing, darkness. So it's a great way to address those things, especially if you're not ready to go to that next step.
And that's done by a nurse practitioner.
Or a doctor.
Or a doctor. I mean, I don't think registered nurses can even do that one.
Probably depends on the state,
Right.
but yeah.
But there's a lot of experience involved because we want people to do it. The good thing about PRF, it's a natural substance, so it can get absorbed.
Correct.
So that's where a lot of people prefer that. And at the center, I know we're actually all set up, to get PRF also. So really, it's to try to get as much for the patient, short of having a surgical procedure.
Correct.
So tell me, when does someone need surgery?
So surgery is more involved when you're looking for more of a dramatic effect, a longer term effect. So like with PRF, unfortunately, it's not like a one and done treatment. You have to do a couple of treatments to get that look. Where surgery is, that's pretty much you got there. But with PRF, you're addressing the skin. Surgery, you're basically getting with the look, but you're not addressing the skin texture, the pore, everything that you would want to address.
So tell me, I'll talk about something that's very close to my heart. So PRF helps hair loss.
Oh, yes.
And when I was investigating PRF for the center, the aesthetic center, the first thing everyone said, I'm way too gone. And I said, okay, it happened.
Might as well
Everyone
try it.
understood. No, they told me that. So tell me about hair loss. I mean, hair loss is such a difficult thing, especially this is where men come in more. So does PRF help hair loss?
So when I was an RN, I used to work for a plastic surgeon. and we used to do PRP treatments, and
Which is very similar.
pretty much
It's
similar, and you're
yeah.
just injecting the PRP, creating microchannels, and with microneedling. And yeah, as long as you're being as long as you're being consistent with their treatment. I saw men come with really good results, even women too. But the thing with aesthetics is consistency. You want to keep doing the treatments, especially something like that.
And does it help regrow hair or just prevent loss?
Yeah, I saw people.
regrowth.
Yeah, saw regrowth in their hairline.
And that's for men and women?
Men
Because
and
there are
women can
women who
use it.
also have issues with hair loss. I mean, I've sort of resigned myself to the fact.
Well-
But again, people who want to look different, and that's fine, I understand that. But it's something that really is, people, if I went on TV, which we are right now, and said to everybody, I've got this magic that would make your hair come back, or especially in small areas, that's the key part to this, and not someone who's had no hair for a long time. If I told you that basically I can get your hair to come back, you know, how many people would line up for it? So it sounds like
Me.
it sounds like PRF is really is that a relatively new process? Because PRP I know we've used for joints, for inflammation. Really, there's a lot of growth factors, a lot of reasons we use this, and the orthopedic surgeons use a lot more in higher doses. But have you been impressed with the results for it?
Oh yeah, definitely. Again, like I used to have a patient that had a really bad acne scarring, and after a couple of treatments, her face with the glow that you were talking about, as long as you're consistent with these treatments, you're going to see a difference.
Okay, so hair removal, a big thing. So now any wellness center, and again, part of what any medical spa or this type of unit is, and you guys have taught me so much about it, really deals with the wellness of the patient. Again, intravenous therapies. You know, I'm not going to go through NAD and different type of things, but there are a lot of things that you've enlightened me as antioxidants. But I know we, and so I think you, Dan, more than anyone, actually give out GLP-1 inhibitors, or the Ozempics of the world. We can say Mounjaro, any name you want to say. And so tell us a little bit about that, and with regard to, say, people who might have lost weight too quickly, or pregnant women who have skin that's hanging a little bit. Is there anything they could do before they go for a tummy tuck?
Yeah, good question. So Morpheus, like we talked about earlier, again, it uses microneedling and heat. So it can actually help shrink and tighten the skin. And that is a condition, you know, it happens all too often with GLPs. People lose too much weight too quickly. Typical weight loss, a half a pound to 2 pounds per week, but some people are losing 4, 5, 6, 7 pounds, and they're losing it too quick. Then they have that elastic skin.
I think we actually have a graph of it. Like, here's a picture.
Yeah.
Sometimes a picture works.
And then, you know, on the abdomen happens, even on the neck as well. You got this loose skin behind the arms, and that's where Morpheus really helps to tighten the skin and stimulate that collagen and elastin production that can definitely help the appearance of stretch marks.
So it's something
And
that
it's minimally invasive.
So it's minimally invasive. I mean, it's annoying. There's some discomfort.
There's some discomfort.
To
We
any
have-
beauty, there's discomfort.
Yeah, beauty is pain. they say, right?
That's what I've heard.
We have numbing,
But
gel, which helps.
I know you've told me some experience where there've been some pregnant women who, after
Pregnant women as
birth,
well.
you know,
Yeah.
they lost a lot of weight, obviously, and they were considering a tummy tuck and tried this instead. So again, the idea of a non-surgical approach, I think, is really something that's amazing.
For sure.
And the patients who are taking GLPs, that whole category of medicine, we're just seeing so many patients who have hanging skin, and it doesn't work for everyone. But I know you've told me, both of you have told me, that you've had some really good success with it. So it's so nice to be able to offer medical options, or things, and these are procedures, but this is way short of having operations with blood loss and intravenous's and things of that nature. So what's your experience with all that?
Yeah, I mean, even as, you know, stretch marks in particular, everybody's self-conscious about stretch marks. So this really can help to kind of smooth them out and make them less noticeable. And yeah, I mean, it goes back to the whole aesthetics, right? Everyone wants to feel good about themselves, look good, especially after pregnancy. You know, you tend to have this loose skin, and I think, you know, it's definitely worth a try before, you know, going under the proverbial knife. Yeah.
So let me ask you, so again, nurse practitioners, physicians have to do a lot of these procedures, What are the side effects? In a sense, when you say that, you've mentioned it with fillers. You have to know where to go. Some of these are inert substances that could stick around there for a long time. Tell me a little bit about What concerns do you have if somebody is doing this who's, maybe not a physician, not a nurse practitioner? What issues of side effects are you worried about?
Yeah, I mean, you could definitely, in terms of the Morpheus, you could definitely, again, it's heat and it could melt off more fat than you would like.
There's a lot of people
and
are
then you
concerned
can
about
have
the pain and the fat
hollowing.
burning.
Yeah, in terms of the pain, we use numbing cream at our facility, and it really does help take the edge off, most definitely. And it's very tolerable. But you would definitely want to do a procedure like that under medical guidance, whether it's a nurse practitioner, a physician assistant, or a doctor. You don't want to go to someone's basement to have these kind of procedures done, because, I mean, it could cause more harm than good, and you're going there to kind of fix the problem and not make it worse.
And again, not to talk about what people are doing. People do a lot of Botox at home, Botox parties. I don't know. Maybe I'm very old school. I like to have things in a relatively, again, this is not sterile. We're not talking about a operating room sterility, but a clean environment where I know where people are coming in. There's nobody else watching you at the same time. You have one-on-one interactions. Again, everybody marks off where they want in their forehead. And I think sometimes at these parties, people are looking to copy the person on their left or right, what they want, rather than what they need themselves. Yeah. So what are your thoughts about these parties or people going around doing it? And again, not to say these are colleagues of yours, I'm sure, who do it. And maybe we've all have done it at a different time. I haven't done it yet. but the answer comes down to what are your ideas about having these kind of things done at a place versus having it done at other areas?
My concern would probably be like safety and like sterilization. You want to always be careful, and also the injection points too. I mean, if you inject wrong here, this is going to go down. And even if you're injecting your DAOs, you could end up with a crooked smile. So
what's a DAO?
The muscle right here,
okay.
You want to turn that frown upside down.
So there are techniques to actually, and maybe let's go through botulinum toxin. And again, we're using that general term. There's Botox, there's a thing called Dysport, any other names? Xeomin. So tell us, on the face, that's where people always are interested. And this is a very visual thing. We've got a minute left. Pointing to Dan. He has a beautiful face. What could you do on someone's face?
I'll smile for you.
And you can just point. You can use the pen and point. Because it's less than a minute left.
So I would ask him to smile for me. We could do a couple units right here to address the crows. But he has a beautiful smile.
And you got the 11, which you rarely
make the
have.
angry face for me. So he's a little frozen for me. But we could address like the corrugators, a little of the head and the tail, the procerus. You want to raise your eyebrows high. So this is where you want to be careful with where you're injecting, because there's usually like a safety margin, and if you inject too low here, this could cause a droop. Sorry if I'm touching your face. It could droop the eyelid. So you don't want to do that.
Tell me about things that we don't know. People want it for their lips. Does it work?
Like if you make that pucker face, you could address the lines here.
People do it for their nose.
Smoker lines.
Yeah, when your nostrils flare out.
And so people have their own wishes with it, but I think one of the things that I do see a lot of are patients who have this constant frown and are very upset. And there are the ways of using botulinum toxin to make that better. I want to say thank you, guys.
Thank you.
We've come to the end of our half hour talking about aesthetics. And it's a fun topic. It's for people to enjoy themselves, feel better about themselves. Get this done at a proper place. Always important for physicians, nurse practitioners, people who know what they're doing. And let's hope we all look aesthetically beautiful and feel good inside. Good night, everyone.